This picture may be familiar to you, as this was already shown in the class of anatomy of nasopharynx. This is how dividing the pharynx into nasopharynx blackish, and this red color is the oropharynx, and green the laryngopharynx, and behind that this part is the hypopharynx. So today's class is on anatomy of larynx, and in this class I will describe about the development of larynx, the different structures constituting, then the paired cartilages, unpaired cartilages, then the extrinsic and intrinsic ligaments, membrane, and also the muscles, also the blood supply, the lymphatic drainage, and also regarding nerve supply. Okay, so that is larynx. It is very clear that larynx, that extending from epiglottis up to the cricoid cartilage, it forms the anterior aspect of the neck, and it lies opposite to C3 to C6, that is 3rd to 6th cervical vertebra, and that in males. But in females and children it will be little more higher. And coming to the dimensions, this length, that is from the upper end of epiglottis up to the lower border of cricoid cartilage, it is 44 millimeters. Okay, it is 44 millimeters in males, whereas it is 36. The length is lesser in females, that is 36 in female. And the transverse diameter, this diameter from here to here, this part, it constitutes around 43 millimeters in male and 41 in females, and AP diameter from anterior to posterior, this much. This is 36 in males and 26 millimeters in females. This anteroposterior dimension is almost equal in boys and girls up to puberty, and after that it becomes almost doubles in case of male. Development of larynx is very important. By knowing the development, you can correlate many things, especially the blood supply and nerve supply with the anatomy. So everything starts at 4th week of introductory life. At 4th week, these are the pharyngeal swellings or arches, and this becomes the lingual swellings, the future tongue, and at the root of the second arches there comes the, which one? At the root of tongue there comes the foramen cecum, and these are the third one and 4th to 6th also. So caudal to the foramen cecum there comes a foregut. So from the ventral wall of foregut, this is your foregut or the pharynx. From the ventral wall of foregut there comes a groove which is called the laryngotracheal groove. Okay, so this is called the laryngotracheal groove. This groove arises from the ventral wall of pharynx, and later, and this deepening is from caudal to cranial direction. Okay, it starts deepening from caudal to cranial. So that what happens? So that it becomes a laryngotracheal tube. Okay, so from the groove it becomes a laryngotracheal tube, and from this you can see that the cranial end is not fusing together. The lips are remaining separate, so that there is an aperture through which this laryngotracheal tube can communicate with the foregut. And later this part becomes the esophagus, Okay, so this becomes the esophagus, and from the cranial end of the laryngotracheal tube, this area, that becomes what? That becomes the larynx and trachea, this area. Okay, so from that comes larynx and trachea, and the lower part or the caudal part, again it becomes separate into two tubes. So that becomes the bronchus and also the future lung buds. Okay. This become right and left lung buds. So our area is this much, that is the larynx and trachea, which is developing from the cranial end of the laryngotracheal tube. It becomes here, this part. Okay. That is up from 3rd to 6th arches. And this area, at first it is like a vertical slit, that is a larynx. At primitive larynx is a vertical slit, and later it becomes T-shaped, like this. You know that in adult also this is your vocal cord, and this becomes your arytenoids posteriorly. Like that, this becomes T-shaped as there are two swellings from the 4th to 6th arches develops, and it goes, these swellings goes towards each other, and also they go towards the hypobranchial eminence. This is a hypobranchial eminence which later forms the epiglottis. Okay, this is the hypobranchial eminence. Okay, so this hypobranchial, arytenoids swellings from the two sides of the laryngotracheal tube, they grow towards the hypobranchial eminence and also towards each other. So that later it will become, this hypobranchial eminence will become the epiglottis, and the arytenoid swellings from the 4th arch becomes the arytenoids, and the part which develops from the arytenoids towards the hypobranchial eminence or the later epiglottis becomes the aryepiglottic fold. Okay, over the arytenoid there are two small cartilages. They are the corniculate cartilage. So arytenoid, corniculate on both sides, and then comes the aryepiglottic fold. And in the aryepiglottic fold there is another small cartilage which is a cuneiform cartilage. Isn't it? That I will tell later. So this is the epiglottis. Epiglottis developed from the hypobranchial eminence, which is from the 3rd arch, and also this cuneiform. Okay. So this hypobranchial eminence, that is a 3rd arch, from epiglottis developed from 3rd, and also cuneiform developed from 3rd. Arytenoid along with the corniculate developed from 4th. Some textbooks say it as 6th also, but majority textbooks are telling as 4th arch. So corniculate and arytenoid is from 4th arch. And this thyroid cartilage developed from 4th also. Thyroid is from 4th, and the more caudal, cricoid and trachea. Also trachea is from 6th arch. This becomes your tongue. And the foramen cecum, and below that you will get the epiglottis with the arytenoids on both sides. The aryepiglottic folds with the corniculate and the cuneiform cartilages, and also your vocal cords, false cord as well as your vocal cord. And the nerves, there are nerves of 4th arch is the superior laryngeal nerve, and the nerve of sixth arch is the recurrent laryngeal. So the upper part is supplied by superior laryngeal and the lower part is supplied by recurrent laryngeal. So everything starts from 4th week of intrauterine life. From the ventral foregut, first there is a laryngotracheal groove, then turning to laryngotracheal tube, and the caudal part becomes the bronchus and lung buds, and the cranial part becomes the larynx and trachea. So that the epiglottis and the cuneiform is from 3rd arch, that is from the hyperpharyngeal eminence, and the corniculate and arytenoid are from 4th arch, and thyroid from 4th, and again cricoid and trachea is from 6th arch. The main constituent of the larynx is laryngeal cartilages. So what are the laryngeal cartilages? You have the epiglottis, which is coming here. Then this is the thyroid cartilage. Then after that, on the posterior aspect, this is from the anterolateral. On the other side, from posterior aspect comes the arytenoid. There are 2 arytenoids, and on the corner of the arytenoid lies the corniculate, and more towards the aryepiglottifold lies the cuneiform. These are paired, and this becomes this one, that is the cricoid, which is narrower anteriorly and it is broader posteriorly, and it is a complete ring also. So from this you can see what are the paired one. Paired ones are arytenoid, corniculate and cuneiform, and also another cartilage is cartilago-trititia, which is lying on the thyrohyoid membrane. Okay, on the lateral thyrohyoid ligament you have this cartilago-trititia, that is also paired. Okay. So there are 4 paired cartilages and 3 unpaired. Epiglottis, thyroid and cricoid are unpaired. First is the thyroid cartilage. It is, you can see it here, right? So it is a unpaired cartilage, which is the largest cartilage of the larynx, developing from which arch? From the 4th arch. Okay. Anteriorly, the both side there are 2 halves, they are coming and meeting in anteriorly, forming a notch. This is called the thyroid notch, and in males you can palpate the thyroid notch as a prominence, which is called the Adam's apple. And this part, this the 2 lamina, right and left lamina, come and meet in the midline. This part, this is the thyroid notch, and this angle is 90 degree in males and it is 120 degree in females. And in male this thyroid notch is very prominent also, and towards laterally or posteriorly they are going and forming this superior cornea and also the inferior cornea. Okay, this superior cornea and the inferior cornea. This superior cornea is going, how is it going? It is backward, upwards and medially, and there comes the attachment of what is here? It is the lateral thyrohyoid ligament. Okay, lateral thyrohyoid ligament. Here, there is also a median thyroid ligament. This is a lateral thyroid ligament. From thyroid to the hyoid bone. This is hyoid bone. This is a lesser horn and this is a greater horn of hyoid bone. So that is regarding the superior cornea. And what about the inferior cornea? Here comes the inferior cornea, and the inferior cornea has got a facet. What is this cartilage? This is a cricoid. So the inferior cornea has got a facet for articulation with the cricoid cartilage also. Okay. And there is one more thing, one important thing in the lateral, that is in the lamina of the thyroid cartilage, is the oblique line. See, here there is a superior thyroid tubercle and here is an inferior thyroid tubercle. So from the superior thyroid tubercle coming to the inferior thyroid tubercle is an prominence, and that is called the oblique line. Okay, this oblique line is important. The attachment of oblique lines are important. there are three attachments to the oblique line. So the first one is, what is that one? There are three muscles actually. So what is this muscle? This muscle is thyroid muscle. Okay, from thyroid to the thyrohyoid muscle. And this one, sternothyroid muscle. Second, sternothyroid, from sternum to thyroid, sternothyroid. And this one, this is the inferior constrictor. Okay, so three muscles. They are inferior constrictor. Actually, it is the thyropharyngeus part of the inferior constrictor. The inferior constrictor has two parts. One is a thyropharyngeus and this is a cricopharyngeus. So that is the thyropharyngeus part. If you can't remember, just remember it as an inferior constrictor. So to the oblique line, attachment of thyroid, sternothyroid and inferior constrictor muscle. If you draw the inner aspect, it will be like this. So this is the inner aspect of the this thyroid cartilage. Just below the thyroid notch, you have this ligament, thyroepiglottic ligament. You can see it here. This epiglottis is coming posterior to the hyoid bone and coming and attaching to the, it comes here. Actually it comes here. Okay, so this part, just below the, this notch, thyroid notch comes and attaches to the thyroepiglottic ligament, and on both sides of midline you have your vestibular ligament and also the vocal ligament. Okay, so this is the thyroepiglottic ligament. This one, and this is a vestibular ligament and vestibular fold and one vestibular fold, and medial to that comes the vocal fold. Okay, and there are also three muscles. Which are the three muscles? You have your thyroepiglottic muscle, then thyroarytenoid muscle and also vocalis muscle. Right? So there are one ligament which is the thyroepiglottic ligament. There are two folds which are the vestibular fold and the vocal fold. Actually this vocal fold of these two sides, which will fuse together and it forms the anterior commissure. From the vocal fold goes the true vocal cord, and the vocal fold of two sides will fuse together to form the anterior commissure, which act an important role in the spread of laryngeal or vocal cord malignancies. Okay, and there are three muscles. One is you can remember the name of the muscle by remembering the site of attachment. So from thyroid to the epiglottis, thyroepiglottic muscle. From thyroid to the arytenoid goes the thyroarytenoid muscle and also the vocalis muscle. So this is the inner aspect and this is the external surface, and also you remember the oblique line. Right? The next unpaired cartilage is what? It is here comes the cricoid. Okay. So the cricoid cartilage, which is the only cartilage in the larynx which has got a complete ring. Actually it is the shape of a ring. Okay. Shape of a ring. It has got an anterior arch and posterior wider part. It is like this. This becomes the posterior part and this becomes the anterior part, similar to the ring you wear. Anteriorly arch and posteriorly there is a quadrilateral lamina. It's a very broad quadrilateral lamina posteriorly. So it will be like this. This is the posterior part. This is a side view. Here, this part with the arch anteriorly and the quadrilateral lamina posteriorly. Okay. and it is a complete ring also, and it is lined by mucous membrane entirely. So let us see what are the attachments. From here it is very easy to remember. On anterior arch there is not much of an important structures. On the lateral aspect, this part, what all things are coming? One is, which muscle is this? Cricothyroid muscle. Okay, so this is this part. Okay, cricothyroid muscle. Remember, from thyroid to cricoid, this muscle is coming. And another muscle, what is this one? Attached to the oblique line, that is a cricopharyngeal part of inferior constrictor muscle. So this is inferior constrictor. And there are facet for two joints. What are they? One is, this is a lesser cornea of thyroid. So it forms what? Cricothyroid joint. So this is cricothyroid joint. And what is another thing? One which is coming on the sloping edge of the posterior part. Actually this quadrilateral lamina has got sloping shoulders, and on the shoulder, see, this has got sloping shoulders, and there comes the articulation for arytenoid. Facet for articulation with the arytenoids. Here also, these two sides, there is facet for articulation with the arytenoid. So actually it has got two joints. One is the cricothyroid joint, and another one is cricoarytenoid joint, and both of these are synovial joints covered with the membrane. Posteriorly, that is on the posterior part of this larynx, is actually attached to, or it is facing the esophagus and also the arytenoids, isn't it? So you can remember in that way. So the posterior part, that is the quadrilateral lamina, on the midline there is attachment of the longitudinal muscles of esophagus. Here comes it. Longitudinal muscle of esophagus. Okay. And what are the two muscles on attached to both sides? Is the posterior cricoarytenoid muscle. Posterior cricoarytenoid. Okay. So that is regarding our anatomy of cricoid. That is it developing from the 6th pharyngeal arch. It has got an anterior arch and a posterior broad quadrilateral lamina, and the attachments mainly to the quadrilateral lamina. It is a longitudinal muscle in the midline vertical ridge, and also posterior cricoarytenoid on both sides, cricothyroid muscle on the lateral part, and also the inferior constrictor, and it is articulating with the thyroid and also with the arytenoid, forming the cricothyroid and also the cricoarytenoid joint. The next one is an unpaired cartilage. What is this? This one is an epiglottis. Actually this is a thin and leaf-like elastic fibrocartilage, and its main function is protection of the laryngeal inlet. So from this you can see that it has got an anterior surface, it has got a posterior surface, and superior border is free. So it is actually coming behind the tongue and also the hyoid bone. Okay, it is attached to the inner aspect of the thyroid cartilage, just below the thyroid notch. Along with the interior of the thyroid, I told it is attached just below the thyroid notch, this part. And this is called the petiole of the epiglottis, and this one is the thyroepiglottic ligament. Okay, this ligament is called the thyroepiglottic ligament. This part, and from the thyroid cartilage it is going superiorly behind the tongue as well as the hyoid bone. Okay, so to the tongue, this is your tongue, and it is epiglottis is attached to the posterior one-third of tongue by a median glossoepiglottic fold and 2 lateral glossoepiglottic fold. This is a median glossoepiglottic fold and two lateral actually glossoepiglottic fold, and between these two comes your vallecula. Okay, so between this median glossoepiglottic fold and the lateral glossoepiglottic fold comes the vallecula. Okay, that is the relation with the tongue, and it is also attached to the hyoid bone by an hyoepiglottic ligament. And actually the space between this hyoid bone and the epiglottis, this is attached, this is going, if this is a hyoid bone, it is going below this, like this, to the thyroid cartilage, and in between there is a connection from the epiglottis to the hyoid bone, and it is called the hyoepiglottic ligament, and in between there is a space which is filled with the fibrofatty tissue only, and that is called the pre-epiglottic space. That is the space between this epiglottis and the hyoid bone. It is called the pre-epiglottic space. That is very important in relation with the spread of carcinoma. And the lower border of this pre-epiglottic space is formed by the hyoepiglottic ligament. Hope you got it. So the epiglottis is actually, if this is the hyoid bone, epiglottis is going behind the hyoid bone to get attached into the thyroid cartilage. So the space between this hyoid and the epiglottis, there is a connection called the hyoepiglottic ligament, and this anterior part is empty and is filled with the fibrofatty tissue, and that is called the pre-epiglottic space. Okay, that is important. The boundaries of pre-epiglottic space you have to study. Posterior surface, the cartilage bears numerous pits also, and also there is a central tubercle which is present on the posterior surface. And on the sides, what about the sides? So I told about the posterior surface and also the anterior surface. And what about the sides? This is a cut section. If you cut it like this, the picture will be like this. So this is a cricoid cartilage, and these are the two arytenoids on the posterior aspect of this quadrilateral lamina. Okay. Along with the quadrilateral lamina, I told you the arytenoids are sitting on the superior sloping shoulders of the posterior quadrilateral lamina. It is here. Okay. So this epiglottis attached to the arytenoids by aryepiglottic fold. A free border or the lateral aspect of the epiglottis is connected to the arytenoids by means of this aryepiglottic fold. On both sides it is coming, isn't it? So actually this epiglottis with the aryepiglottic fold, it forms the boundary or it forms a marginal zone of the laryngeal inlet. So superiorly comes a free border, and from laterally there comes the aryepiglottic fold. So the free border along with the aryepiglottic fold, it forms the inlet or the marginal zone of this larynx. It is leaf shaped in adult. I already told it is leaf shaped in adult, but in children it is omega shaped, and even the minor edema of this epiglottis can cause serious respiratory obstruction in children. Arytenoid cartilages are 2 in number, paired cartilages, and they are sitting on the sloping shoulder of the posterior quadrilateral lamina of the cricoid cartilage. Here it sits here. It is a 3-sided pyramid, and it has got an apex. On the apex, on the corner of the apex lies a corniculate cartilage. Okay, here sits the corniculate cartilage, and also the fibers of this aryepiglottic fold is attached there, and the base is attached to the cricoid cartilage, and the posterior surface on that part, it is completely covered by the transverse arytenoid muscle, and also there is a posterior cricoarytenoid ligament which prevents the forward sliding of the arytenoid cartilage. So on the posterior surface there is a posterior cricoarytenoid ligament as well as the transverse arytenoid muscle. So the apex, the base and the posterior surface. And what about the medial surface? Actually the medial surface forms the lateral boundary of the, it comes like this. This is your vocal fold, and here comes the, this is the medial border. So that forms the lateral boundary of the cartilaginous portion of epiglottis. Okay. So apex, base, posterior and the medial. In the lateral part there are two projections. One is forward projection, that is the vocal process, and to the vocal process attach this part. Here this vocal process attach the vocal ligament, and it has got a muscular process also laterally, and this muscular process attaches the cricoarytenoid muscle, both posterior cricoarytenoid muscle and also the lateral cricoarytenoid muscle. Okay, so the muscular process and also a vocal process. And in between this area, this surface is here, this anterolateral surface. It has got two depressions. One is for attachment of the vestibular ligament, and the lower depression is for the attachment of vocalis muscle and also lateral cricoarytenoid muscle. Three muscles are attached to the cricoid. Posterior surface there is a transverse arytenoid muscle, and to the muscular process attaches the cricoarytenoid muscle, both posterior and lateral fibers, and also on between this muscular process and the vocal process on the anterolateral surface vocalis muscle is also attached. So vocalis muscle, cricoarytenoid muscle and the transverse arytenoid muscle are attached to the arytenoid. About the arytenoid, which has got an apex for the attachment of corniculate cartilage, the posterior surface, the base, the medial surface which forms a lateral boundary of the intercartilaginous part of epiglottis, and also an anterolateral surface. Also three paired small cartilages. One is on the lateral thyroid ligament, that is the Cartilages, and another one is a corniculate cartilage of Santorini, which is situated on the apex of the arytenoid. It is again a conical shaped cartilage, and another one is cuneiform. This one, cuneiform cartilage of Brisberg, which is sitting more towards the middle part of epiglottic fold, and both of these are elastic fibrocartilages.